Hi, my name is Jessica Stacy, and I am going to show you how to do a general abdominal assessment on a 28-year-old healthy male. He does not have any surgical history, any medical history, doesn't take any medications. He follows up with his doctor regularly. I have asked him about his bowel pattern and his urination. He denies any burning while urinating, any difficulty stream. He reports his urine being light yellow and clear. It's important to ask if the patient has difficulty starting stream because that could indicate some prostate issues, especially in older men. His bowel pattern, he said he has a bowel movement every day and it's regular, so no constipation or diarrhea, so that's good. Next, we're gonna observe his abdomen. We're gonna start from less invasive to most invasive. So what we're gonna do is just look at his abdomen. He's breathing and his respirations are normal. His color is within normal limits. There's no bruising noted, no surgical scars, nothing is noted, so everything looks really good. Next, we are going to auscultate. So what we're gonna do is we are going to listen to each quadrant of the abdomen. We want to listen for active bowel sounds. If they are hyperactive or hypoactive, we want to know why. We want to dig further. If they're absent in a quadrant, we want to listen to that for at least 2 to 5 minutes. And if you still don't hear any bowel sounds, that's a medical emergency and we need to call 911. It could indicate a bowel obstruction or something really serious. So I'm going to go ahead and listen to each quadrant. Also, while I'm auscultating, I'm going to listen to the abdominal aorta, which is above the umbilicus, and his renal arteries, which is lower, and his femoral arteries as well. So I'm going to go ahead and auscultate each quadrant right now. Okay, each quadrant have active bowel sounds. So next I'm going to go ahead and go down to the abdominal aorta. I want to hear a normal sound. I don't want to hear any whooshing or any bruise noted. I'm going to listen to with the diaphragm and the bell on each of these. Okay, all the sounds are normal. No bruise noted. So next I'm going to palpate. I'm going to do a general palpation, make sure there's no tenderness or anything before I get into the percussion and the deep palpation. So I'm going to go ahead and palpate each quadrant. I'm just going to do that with the tips of my fingers. No tenderness. Okay, good. Okay, no tenderness noted there. So I'm going to do some deep palpation and I'm also going to do some percussion. So when I percuss, I am going to do my, have my dominant hand and then my non-dominant hand. So my non-dominant hand is going to be on the abdomen. And my dominant hand, I'm going to take my middle finger and I'm just going to tap on the middle finger that's on his abdomen. And what I'm listening for a drum sound in each quadrant. If I hear a dull sound, that could indicate maybe some fluid in the abdomen, and I don't want to hear that. I just want to hear that drum sound that just because your abdomen could be like it's full of air, and that's the normal finding I want to listen to. So I'm going to go ahead and percuss, and you want your patient laying completely flat when you do this. So I'm going to move that pillow. So you want to do it quick also. Good. Okay, so that is good there. So next I'm just going to palpate his right upper quadrant where his liver is, and what I'm going to do is I'm just going to palpate here, and you can feel that liver border. You can also measure it, and there's no pain there. Another way you can measure it is you can do percussion, and you're going to go up until you hear that drum sound, and then you're going to mark it right there where you can measure it. On the other side, his left upper quadrant is his spleen. So you want to palpate that. We don't want to feel the spleen. We're not supposed to feel the spleen. What it is the spleen is underneath your ribs. So if you were to be able to feel the spleen, then that means there's a spleen enlargement, and that's an abnormal finding. So what we're going to do is we're going to go to that 10th rib, and we're going to feel right there. And take a deep breath for me. And it shifts upright. Good. So there's no pain there, and I don't feel the spleen, so that's perfect. On this right side is his lower quadrant is his appendix, and I'm also doing some deep palpation, and he's denying any pain on that, so we're good here. So next I'm going to have him sit up, and I am going to check his back for some tenderness. The CVA tenderness, it's on the back tapping. So what we want to do is we want to get that 12th rib, and you just want to take your hand and take this and just make sure there's no pain there. Pain can indicate a kidney infection, because it could mean kidney inflammation. So there's that. That is just a general abdominal assessment. You can get a little bit more invasive, but that is just a general one that I have done. So thank you so much.